It is a true honor and a pleasure to be joined today by Dr. Charles Fritz Kraft, State Dental Director, a 1980 alumnus of the College of Dentistry, and the 2019 American Dental Association Humanitarian Award recipient. Dr. Kraft, thanks for being with me today. Tremendous, tremendous honor. And I want to take just a moment to read a little bit more about this very prestigious award that you recently received from the ADA. So for our listeners, just want to describe this award. Established in 2008, the ADA Humanitarian Award annually honors an ADA member for creating a legacy of volunteer work and is one of the association's highest honors. Criteria for the Humanitarian Award include significantly improving the quality of life and oral health of individuals both in the U.S. and abroad over a period of 10 years or more, demonstrating significant leadership and serving as an inspiration to others both in the dental profession and the general population. So you can appreciate what a prestigious award this is, and if you would, Dr. Kraft, just share with us a little bit about I know you've done so much service, but globally, what has that looked like?
Well, first of all, Dean Guthmiller, thank you very much for the recognition and for the support in Nebraska and overseas. I did graduate in 1980 and I joined the U.S. Public Health Service as a dental officer. I was assigned to the Indian Health Service in Alaska. Specifically, I was on the Bering Sea coast and we were helping Indian and Eskimo and Aleut patients. We worked out of a base hospital, but then we traveled by airplane, snow machine, or boat with portable equipment and traveled to the villages and would help the native people. The real challenge there, besides the environment and the cold and the dark, was providing the same level of care in such a remote area as we would back here in Nebraska. But we were able to achieve that, and later I started traveling to other countries, especially developing countries, and I just noticed the overwhelming need, and so some of those same principles that we learned about public health in Alaska could be applied to other countries and be successful too.
Right.
Yeah.
So across the globe, around the world, tell us a little bit more about the East Meets West program that you founded in Vietnam.
Well, I had traveled to a few countries such as Jamaica, Samoa, Nepal, Thailand, but in 1993, I think, Vietnam was a reopening country. It had been closed for 20 years after the war ended in 1975, and it was isolated. But I believe it was 1992 or 1993 that a few people could actually go in and visit the country. And I went into the city of Saigon, also known as Ho Chi Minh City, and I had an official government guide, but I did rent a car and I traveled from the south all the way to the north up to Hanoi. It took me about 2 weeks, and what I saw I still haven't seen to this day. The devastation, the destruction of the countryside. There was no color on the buildings. There was no energy in the people, no excitement. Especially you would notice it on the village people where they were just wearing very poor clothing. Many were missing arms, legs, eyes, and the biggest thing was no one was smiling, even the children. There was no, hope for the future. People were just existing day to day. And I also noticed on that trip that the healthcare system had just been destroyed. At one point, the French had installed rural clinics and urban hospitals, but that system had been destroyed, and most of the educated people and doctors and dentists had been greatly affected by the war. The universities had closed and they were just reopening. So I went into some hospitals and the standard of care was, I mean, people didn't go to the hospital to get well, they went there to die. And so I saw a lot of need, a lot of desperate people, and it was, no one was really interested in re-engaging in Vietnam at that point. And so I kind of thought, well, maybe I could help at least on dental. And I went to a couple orphanages and met the children that are innocent, as they are anywhere in the world. And I said, well, maybe we could do something to at least help them grow up and have healthy teeth. And I knew I had a lot of friends back in Alaska in the public health. I knew that a few of my relatives, my parents, might support something. And so we did start a program in 1995 using the same portable equipment that we had in Alaska. And we hired some local Vietnamese dentists that we trained, and through the use of translators. And it was quite a learning experience, and it took a long time to develop the program, but over the years it became successful.
Well, and you've transformed how many thousands of smiles, there, elsewhere, and have done so. Our students often have joined you, other faculty, other dentists from Nebraska and around the country. So we know that you're doing so much throughout the world, but tell us a little bit also what you're doing here in Nebraska.
Well, in Nebraska we have public health needs, just like they do in developing countries. Our needs mostly in Nebraska are rural or low income, particularly young children or older adults. And so I often try to, I work with the Office of Oral Health for the state of Nebraska, and we often try to partner with the College of Dentistry here on our outreach programs, especially through the coordination of Dr. Brown and Dr. Harn and Dr. Lang. But we sometimes do events here at the college, like Sharing Day or Children's Dental Day. But we also go out west to Gordon and Western Dental Days. And we often have dental health fairs right here within the city of Lincoln or in Omaha. So the same principles that apply in Alaska in public health apply here in Nebraska or apply in a developing country like Vietnam.
Mm-hmm. Well, thank you for being a tremendous partner, and we thank you for all that you do here in Nebraska, throughout the United States, as well as truly the world. Congratulations on this very prestigious award, Dr. Kraft.
Thank you very much, Janet. I do appreciate all the support, and I hope that I've noticed in the young students, their interest in engaging the community and caring about people in need. And I think that energy that they show now hopefully will carry throughout their whole career.
Thank you, and thank you for being a role model for our students, our faculty, our staff, and providing continued great oral care for the citizens of Nebraska and beyond.
Thank you.
Thank you.